I would like to introduce Dr. Tom O'Brien, who is an internationally recognized speaker, and he is the founder of thedoctor.com, and also he is behind the glutensummit.com. Hi, Tom. Thank you for being here today. I know today we're going to be talking about dangers of a gluten-free diet. Before we get started, can you maybe tell us a little bit about the Gluten Summit and, what exactly is that?
Oh, yes. Thank you. Thank you, Kristen. It's really a pleasure to be with you. And I want to acknowledge the work you're doing, to carry this message out. I know how stressful it is for families that have autism or someone on the autism spectrum, and how stressful it is to learn how do I help this body function better. So kudos to you for the summit that you're doing and all the work that you guys do. I think it's just fabulous. So thank you so much from all of us, that you do this. It's really quite remarkable. Yeah, the Gluten Summit. In 2013, I traveled the world and I interviewed the world leaders on the topic of gluten sensitivity, with or without celiac disease. For example, if someone is being tested for celiac disease, which is when you have a gluten sensitivity affecting your gut, it doesn't have to affect your gut. It may just affect your brain. But if it affects your gut, and you have the genes for this, you can develop what's called celiac disease. And when they do a test for that, they do an endoscopy, a tube down the throat to look at the stomach, and the report that comes back from the gastroenterologist says Marsh 1, Marsh 2, Marsh 3, in terms of how much damage there is in the intestine. Well, I went to Oxford, England, and I interviewed Marsh, the godfather of all of this. And Professor Marsh was just marvelous and so generous with his time to explain that celiac disease is very important to know about, but it's only one aspect of a sensitivity to gluten, that it may affect you without affecting your gut. I went to Bologna, Italy, to Professor Umberto Volta, who chairs the Celiac Society of Italy, and he's written over 450 papers on non-celiac gluten sensitivity. He is the godfather of this. We interviewed Dr. Daniel Amen, who has done over 40,000 SPECT scans. Now, SPECT scans are when you look at blood flow into the brain. And Dr. Amen talked about how foods, and in our discussion, gluten or dairy, may affect the brain function. And so you have brain dysfunction because of a food and not enough blood getting into the brain. That's one of the most common mechanisms by which a food sensitivity will affect the brain, by the way. It's called a lack of blood flow into the brain. The technical term, the Scrabble word for that, is hypoperfusion. Hypoperfusion. And so I interviewed these 29 leaders from around the world, and they all were 1-hour interviews. And I said to them beforehand, I said, Professor Volta, if you, during our interview, I may interrupt you. And he's a very formal man, an Italian guy, and he kind of looked at me, and I said, because if you say a word that you and I understand, but someone in the audience does not understand, that person may start thinking about dinner. Their brain may, will go somewhere else. And he said, oh, yes, of course. And so I did interrupt some of our interviewers many times during the course. So, Professor Volta, I'm sorry, that hypoperfusion, is that a lack of blood flow into the brain? Yes, that is. Oh, thank you so much. So it was remarkable. And we've had over 200,000 people now who have listened to these interviews. And we still get emails every week. I got 18,000 emails in the first month afterward. Literally 18,000 emails to say thank you so much. And well, I'm currently in Phoenix, Arizona, where I'll be lecturing tomorrow. And flying here this morning, I went through TSA. And on the other side of TSA, when you're grabbing your things that have gone through the X-ray scanner, this woman walks up to me and she says, excuse me, are you Dr. O'Brien? And I said, yes. And she started crying. She just started crying, standing there crying. And this has happened many times before. And so I put my hand on her shoulder right away. I knew. And this guy comes walking up, and he'd come through the scanner and looking concerned. And he said, no, honey, this is Dr. O'Bryan. And he said, oh. And he shook my hand, and she said, you saved our daughter's life.
Oh, wow.
Go gluten-free that day. And their daughter was 14. And she came through the scanner, very pretty young girl. And she had idiopathic juvenile arthritis, which means we don't know why you've got it, but you've got arthritis. Started when she was 3 years old. And the only drugs that worked for her were steroids, really strong drugs. Nothing else worked. And they'd try to get her off the steroids because they're so detrimental long term, but her pain would come back to the degree that she couldn't walk. And so they had to put her back on the steroids. And this was for 11 years she was on steroids. And they listened to the Gluten Summit. They decided immediately to go gluten-free and dairy-free. Their daughter's pain was gone in 1 week. Completely gone. Completely gone.
Wow.
So this happens all the time. When people hear the information, if you hear the right information or the comprehensive information, and my emphasis is always on the science. And so the Gluten Summit is 29 of the world's leaders being interviewed on their area of expertise, because I read their research papers. I knew what their specialties were, so I asked them all the questions that would be the questions that people would want to know about. And the result was just spectacular. It was, I'm so proud of that. So that's the Gluten Summit. And you can find out more about that at theglutensummit.com. But one of the things it did is that it brought a lot more awareness to this whole topic of gluten sensitivity, and it took it out of the realm of being a fad if you don't have celiac disease, because now you're listening to the world experts. And very few people have the time or the access to read their research papers. But now when you hear them speak and it's kind of interpreted to everyday language, it starts to make so much sense. So that was the Gluten Summit.
And it's so needed. And gosh, just hearing that story about that little girl and, how you changed her life. I mean, we always have this thought in our minds at AHA of if we can help one person, then that's all that matters. Now, I know you've helped thousands and thousands and thousands, but, just knowing
right.
that one family, I mean, that just has to feel so good. And to know that if you didn't have that, they wouldn't, who knows how long they would have taken to been able to find that information out,
That's exactly right. That's exactly right. How long they would have been suffering and with unnecessary pains. A sensitivity to a food, and gluten is one of the most studied foods. And I believe it's the most common sensitivity now. It goes neck and neck with dairy, but it's right up there, either the most common or very close. A sensitivity to a food is going to manifest wherever the weak link is in your chain. If you pull at a chain, it breaks at the weakest link. It could be one end, the middle, the other end, your heart, your brain, your liver, your kidneys, wherever your genetic weak link is. That's where the symptoms are going to come when you pull on the chain too hard. And in this example, what I'm referring to here in our talk today is about the brain. That if that's the weak link in your chain because of genetics or because of accumulated things that happen, for example, it's called antecedent, what's come beforehand into your body, the history, and you have too much mercury in your body or too much lead or toxic metals or the things that have happened beforehand, between your genetics and your antecedent, that determines where the weak link is in your chain. So for one person, a sensitivity to gluten will manifest in their intestines as celiac disease. For the next person, it may manifest in their joints as unexplainable arthritis, idiopathic arthritis. For the next person, it may manifest as psoriasis. For the next person, it will manifest in the brain as learning disabilities or autism. It would be very silly for me to say that a gluten sensitivity is the primary cause of autism. As all of your attendees in your summit are learning, there are many different things you need to think about on the checklist. of how is this affecting my child? Is this something I should be looking into? So there's no one magic bullet, that there are many, many triggers. But a sensitivity to gluten is a very, very common trigger or an irritant to whatever the other trigger was. That if you get this inflammation in your body, as far as we know, all diseases at the cellular level, all diseases are inflammatory in nature. There's inflammation going on in all diseases. So it just depends, is it a kidney cell or a brain cell? Is it gasoline or kerosene? So if you're throwing gasoline on the fire and the weak link in your chain is the brain, that's how it's going to manifest. Now, I'm going to give you an example from the literature that is going to demonstrate how food sensitivities can impact in a way that you would never think possible. In Sweden, they have socialized medicine. They have records on everybody, right? And when a baby is born, a newborn baby, they poke that baby's finger and they take a drop of blood, they put it on the card. They dry the card and they store the card. They've got 30 million cards. They've been doing this for a long, long time. So they took people who were currently diagnosed with schizophrenia. Now, that's a disease of brain function where people just, it can be so bad they just can't function in everyday life. And they went back and they looked at that drop of blood on the card from when they were born. And they looked for antibodies to gluten, to the most common peptide of gluten that's looked for. It's called alpha-gliadin. They looked for antibodies to alpha-gliadin. Now, babies don't make antibodies at birth. But wait a minute, if you're checking for antibodies in the blood at birth, what are you looking at? You're looking at mother's antibodies. Because in the 8th month of pregnancy, mom's body starts sending antibodies down to the baby. They're the category of antibodies called IgG antibodies. Why? So mom's antibodies go down to the baby in utero and say, okay, baby, here's some antibodies to cats. We've got cats at home. They're nice cats. You don't have to get upset about this and have an immune reaction. So I'm going to prime you to let you know we've got cats. Or we live in the woods and the leaves fall down, the leaves decay, and there's mold in the air. Here's some antibodies to mold. So baby's body is being prepared for the environment that baby is about to come out into. And what environment is baby about to come out into when baby is born? Mom's environment. It's a beautiful system, prepping baby to prepare for the environment that baby's about to come out into. Because babies don't make antibodies until about 6 months of age, then their system is set up. But for the first 3 to 6 months, the protection is coming through mom. And it starts with during utero in the 8th month of pregnancy. So they look at the drop of blood of the currently diagnosed schizophrenic patients. And they look for antibodies to gluten. What did they find? Those babies in the top 10% of antibodies to gluten had a 70% increased likelihood of developing schizophrenia 30 to 40 years later. Those babies in the top 5% of antibodies to gluten had a 240% increased risk of developing schizophrenia 30 to 40 years later.
Wow.
When I show that study to doctors, because mainly what I do is lecture to doctors, when I show that study to doctors, they sit there like deer in the headlights. And for some of them, their jaw drops. They've never heard of anything like this. They've never seen this. But here's the study. And so then I ask, what's the takeaway, docs, for you in this study? What's the takeaway? Here's the takeaway. All women of childbearing age, especially if they have a family history of any brain distortion problems, depression, anxiety, schizophrenia, Alzheimer's, Parkinson's, every young woman of childbearing, especially with a family history, just gets checked for a sensitivity to gluten. You just get checked just to see, is your body currently, do you have elevated antibodies to gluten? If you do, then it makes sense to say, Mrs. Patient, it's going to be a lot safer to just eat a nutrient-rich, nutrient-dense diet that's gluten-free until you have your baby or baby. Because right now, your body is fighting gluten, and the first study to ever come out like this shows that in sensitive individuals, it puts baby at risk for having a brain that didn't develop properly in utero, and 30 years later, they've got major problems and can't function in life called schizophrenia.
Wow.
So that's the value of a study like that, is that women of childbearing age just be checked just to see, do I have this sensitivity to gluten?
And if they don't have the sensitivity, then they can have gluten during their pregnancy, or do you still recommend staying away from it?
Well, no one knows the answer to that. So I'm going to give you a couple of different opinions that are out there in the medical literature. The first opinion is, if you don't have a sensitivity to gluten, you don't have a problem. Don't worry about it. The problem with that approach is the testing that's used. So I was going to wait a little while to talk about that, but let's talk about that right now. Gluten is a family of proteins. Gluten is not bad for you. Bad gluten is bad for you. There's gluten in rice. There's gluten in corn. There's gluten in quinoa. There's gluten in millet. There's gluten in wheat, in rye, and barley. But it's the family of toxic proteins of gluten in wheat, rye, and barley that are the problem. The other gluten proteins in rice or in millet, corn, they're not problems for people that have a gluten sensitivity. Now, you certainly may have a sensitivity to corn. I'm not saying you don't, but in terms of the topic and the research that's been done on gluten sensitivity, we're talking about the family of glutens in wheat, rye, and barley. So that's the first thing to know. Many people find that they do much better just avoiding grains. So many people do that because they have sensitivity to many different families of gluten. But it's wheat, rye, and barley. That's the main problem. Think of a protein like a pearl necklace. Hydrochloric acid that's made in your stomach undoes the clasp of the pearl necklace. Now you have a string of pearls. And our other digestive enzymes act like scissors to cut off each pearl of the pearl necklace. And the inside of your intestines are lined with cheesecloth. So only certain size molecules can get through. If molecules are too big, they've got to be broken down smaller by the enzymes in the digestive enzymes in the digestive tract. They've got to be broken down smaller in order to be absorbed, to get through the cheesecloth. So they've got to go further down the intestines. That's why you've got 20 feet of intestines, is because some things take a long time to digest. Some things are quick, some things are not. So you've got this pearl necklace. Your body's making enzymes to clip off each pearl of the pearl necklace. Those little pearls go right through the cheesecloth into the bloodstream. Your body then uses those amino acids. That's what the pearls are. They're amino acids. Your body uses the amino acids to make new bone cells or new brain cells or whatever cells you need to make. It's the building blocks to make new cells. The problem with gluten in wheat, rye, and barley is that no human has the enzyme to break down the gluten into each pearl of the pearl necklace. The best we can do is break it into clumps of pearls, clumps of pearls, like a 33 pearl clump, a 17 pearl clump, a 19 pearl clump. That's the best that we can do as humans. So these partially digested clumps of the pearl necklace, they trigger inflammation in your intestines. Your immune system inside your intestines say, whoa, what's this? This is not good for me. I better do something about this. And your body then makes antibodies to fight these clumps of the pearl necklace. the inflammation that occurs and the antibodies cause intestinal permeability. The slang term is the leaky gut. So now you get tears in the cheesecloth of the intestines. So when you get tears in the cheesecloth because of these clumps of the pearl necklace, now you get this leaky gut. And the clumps of the pearl necklace, the 33 pearl clump, the 17 pearl clump, whatever size clump it is, these clumps go right through the tears in the cheesecloth into the bloodstream. And your immune system says, whoa, what's this? This is not good for me. I better fight this. And you make antibodies to these clumps of the pearl necklace. The problem when you're testing for the antibodies, so blood test looks for antibodies to gluten. The problem has been that every laboratory in the country only looks at one clump of the pearl necklace. It looks at a 33 pearl clump. The technical term is alpha-gliadin. So it looks at this 33 pearl clump in the bloodstream. When they do a blood draw, do you have antibodies to alpha-gliadin? If it comes back positive, you've got a problem. But if it comes back negative, it doesn't mean that you don't have a problem with gluten. It means you don't have a problem with the 33 pearl clump alpha-gliadin. And the research studies show that there's at least 62 different clumps of the partially digested pearl necklace of wheat that can trigger an immune response. 62. So why are we only checking one? There is no answer to that question. And every laboratory in the country only looks for alpha-gliadin. Until 4 years ago. 4 years ago, a new laboratory came out called Cyrex Lab, C-Y-R-E-X. And they look at 10 clumps of the pearl necklace, the top 10. So there is this thing, and some of your listeners may have had this happen. They get a blood test done looking for sensitivity to gluten. It comes back negative. Your doctor says, no, see, it's fine. It's fine for you. But, well, wait a minute, doc, if I eat gluten, I feel bad. Well, it must be in your head. See, the blood test is fine. You're fine. That's because doctors don't know that there are 62 different clumps of the pearl necklace that may trigger an immune response. So, and I've written all this out. It's one of my gifts for you today, for the listeners. It's a handout called The Conundrum of Gluten Sensitivity, Why the Tests Are Often Wrong. And I explain all this, and then I have the research articles, and I say, take this handout to your doctor. Ask them to read it. And when they read it, and they see the research studies, and they see the studies, they say, oh, that makes a lot of sense. I didn't know that. Thank you, Mrs. Patient. And then they should order that test for you. So when you're going to be tested to see if you have a sensitivity to gluten, you just want to be sure that you're doing as comprehensive a test as possible so you don't run the risk of a false negative saying there's no problem when there really is a problem.
I think that I don't understand why they don't have why the doctors don't know about how to test all the different clumps, as you were calling it. I feel like in this day and age, with everything and everyone talking about gluten-free, it just seems like when you go into the doctors and you say I'm having issues, they should automatically know how to run all these tests. I think it would make life so much simpler.
Well, you're right. And unfortunately, we think that when we go to a doctor, that doctor's going to know everything about health. It's not possible to know everything about health. There are so many, hundreds and hundreds and hundreds of new articles coming out every day, literally every day. It's not possible. And so unfortunately, this information that's been coming out in the last 10 years is still new information for some people, for some practitioners. And so in my seminars, the doctors hear this and they see the studies, and they see that I'm not making this up. I say, look, here's the article in the Journal of the American Medical Association. Here's the article in the British Medical Journal. Here's the article in the Journal of Gastroenterology. And they just sit there and go, oh, my gosh, I didn't know anything about this. This is fabulous. I'm really glad to know. Thank you. But there are so many that don't know yet. So when you get this article, The Conundrum of Gluten Sensitivity, they'll have that information in there for you. And so you can say, doc, I just heard this interview, and this makes a lot of sense. Could you take a look at this? Could you read this? Let me know what you think. And if after reading that your doctor doesn't order that test for you, it's time to get another doctor on your healthcare team because they're just being rigid. Because this is all science. It's just pure science. And so many people are being damaged by these sensitivities to gluten, whether it causes the hypoperfusion, the lack of blood flow into the brain, or it's affecting their skin, or it's affecting any other tissue of their body, the weak link in their chain, wherever it is. So many people. It's in clinical practice, when you look thorough, my clinical practice is about 6 or 7 out of 10 people that come in to see me. Now, they're coming to me because they're sick, but 6 or 7 out of 10 will come back positive when you look at a comprehensive test for a sensitivity to gluten.
Wow. Now, what about the families? And I know for myself even, when I was first getting my son tested for everything, they weren't doing the right test, and then they kept coming back saying, oh, no, he doesn't need to be on that gluten-free, casein-free diet, which a lot of us start out with in the autism community. What do we say to families that either are on a waiting list and they can't get into the doctor right away to know about the test, or for those that maybe for whatever reason their doctor doesn't have the other tests that you're talking about available? Are there symptoms that they should be looking for, and then is it safe for them to try the gluten-free diet either way?
Yes, you want to learn some things about how to do that, properly, right? Because you don't want to just start eating rice cakes all the time.
Exactly.
Right? So, there's nothing wrong with a rice cake. Once in a while, a little peanut butter and jelly on it is great. Once in a while, it's a treat, as long as your child can eat peanuts and all that. But you want to learn. My philosophy is base hits win the ball game. Stop going for home runs. Everybody wants to be healthy today. I don't want to wait till tomorrow. I don't want to wait till next week. I don't want to take baby steps. I want these symptoms gone now. And there's nothing wrong with wanting that, but be realistic when you're dealing with something like autism, which is a very serious condition. It's going to take time. It's going to take an education process. So there's nothing wrong with going gluten-free as long as you learn how to eat a balanced diet. And there are many, many ways to learn now. There are many great programs out there. You can learn a lot on my website. My website is thedr.com, thedoctor.com. And we've got lots of information. There are many good books out there. The Gluten Summit is a great place. You learn so much about how to transition into a gluten-free lifestyle, because I interviewed 7 world-famous nutritionists amongst all these scientists, these 29 people I interviewed. 7 of them were nutritionists, and they talk about all the little tricks, all the little pearls, how to get your kids to like different things, and how to make them really attractive to your children. So yes, the answer to your question is perfectly safe to do a gluten-free diet, gluten-free, dairy-free diet. You just want to be educated on how to make sure it's balanced, and your child is just not eating gluten-free waffles every day or something like that. You really want to do it properly. Now, I'd like to talk for a minute about this gluten-free food market, if I may, and just talk about what kind of results we see now in the gluten-free world. 3 scientists from the FDA published a paper where they looked at foods that were labeled gluten-free, 275 foods that were labeled gluten-free, and then they looked at 186 foods that were naturally gluten-free. So if a food is labeled gluten-free, then they have to follow the guidelines of the U.S. FDA, the Food and Drug Administration. So these 3 scientists looked at 287 foods, and they did 2 separate tests on them to see, are they really gluten-free or not? And they found that 97.3% of those foods were actually gluten-free. 97.3. Now, in the industry, that's really good. That's a pretty good number for most people will accept that. But if you're one of the 3% that eat what you think you've purchased and you think is gluten-free pasta or gluten-free bread, and it's not gluten-free, and it activates an immune response, and your child has a seizure, or your child goes into a regression of autism because of it, you're not a happy camper, and you never know why. You never know what set it off, because it may happen a day, 2 days, 3 days later, and you're thinking, no, he hasn't. We haven't cheated. We had gluten-free pasta, and then Sam's salads, and then the toast is gluten-free. So you just don't know, and it's just deadly for someone who has a high sensitivity. 97.3% were okay. 2.7% were not. Then they looked at 186 foods that were naturally gluten-free, like you buy rice pasta, and you look at the label of ingredients, it says rice, salt, and water. Okay, well, that's naturally gluten-free. And what did they find when they looked at those foods? 24.7% of them had toxic levels of gluten. 1 out of 4 had toxic levels of, but wait, there's no gluten listed on the label. It's just rice and salt and water. Or it's just oats. It's just oatmeal. What's wrong with that? It's cross-contamination that occurs. That the field, the trucks, that they haul the oats. So they harvest oats, they put them in the trucks, they drive it to the manufacturing facility to process the oats. Well, the trucks that took the oats from the field to the manufacturing facility hauled wheat last week. They don't clean the truck. So you get wheat residue in there contaminating the food. It's a major, major problem today in terms of trying to be gluten-free and keeping these toxic substances away from your child. It's a major problem. You think you're doing the best thing by buying gluten-free cookies or whatever the food is that you're buying, and you just don't know if it's safe or not. You just do not know.
What if it's marked on the box that says, I know when I go to the market often, and it'll say made in a facility that does produce gluten or wheat or milk or dairy, depending on, whatever you're looking for, or tree nuts. What if it says, made in a dedicated facility, a gluten-free dedicated facility? Do we need to worry then?
Okay, so that's 2 separate questions. The first one was if it's made in a facility that does have tree nuts and other things in it. And the answer to that one is yes, you still have to be careful because that's
that would
the
be cross-contamination. Yeah, I don't buy those ones when I see that. I always look at the label, and if it says that, especially what I notice if it's marked gluten-free, and I always turn it over and I look at the back of the label, and if it doesn't, often it will tell you if it's not made in a facility that's dedicated to gluten-free, and so I won't buy it because my son has true celiac on top of autism, and so I'm very, very careful of what I buy. And if I turn over the box or whatever I'm buying and it says, made in a dedicated facility, for gluten-free, I always feel much better. But what's your thoughts on that?
Well, you absolutely should feel better that you're doing the best that you can as a consumer. You're reading the labels, and that's the category where 97.3% of them are gluten-free. But almost 3% are not. And so you may be buying a product that's part of that 3% that's not gluten-free, and you never know. You never know. And it really is a big problem. It causes many setbacks, many, many setbacks. And this has bothered me for years because we know in celiac disease that celiac patients on a gluten-free diet, they still get sick more than people that are not celiacs, and they get diseases earlier in life, and they have a shorter lifespan. It's called the standard mortality ratio. The SMR in celiac disease is 2 to 1. You're twice as likely to die at any age of something compared to someone who doesn't have celiac at the same age. It's 2 to 1. You're twice as likely, with or without a gluten-free diet. And they've looked at 39,000 celiacs to come up with these numbers. So it's a huge problem. This has bothered me for years. How do you help protect your children? How do you help protect people? It's really bothered me. And
especially they need to eat, and so and
exactly.
you're trying to find the best.
Exactly.
What we do with my son, and I'm curious on your take on this, is that our rule is, and I would say 99% of everything he eats now, from time he was 2.5, since we found out, we've always made. But if there's ever a doubt, on something, first of all, I don't give it to him. But now that he's getting a little bit older, he's 14, trying to, if we go to a restaurant, that now, I live in Southern California, so there's a lot of restaurants that are dedicating themselves to saying, quote unquote, they're gluten-free. However, our rule is if we didn't make it, he takes a digestive enzyme that contains an enzyme that helps break down gluten, just in case. So we've been lucky. He's been fine on that, but that doesn't mean that we would give him anything on purpose that had gluten. It's more for that cross-contamination if we ever have a doubt. What's your take on digestive enzymes that help break that down for cross-contamination? Not so much to say, yes, now you can go eat a gluten pizza, you know what I mean? Just more for the cross-contamination part.
That is an excellent question. You are really well researched. I can tell you're a mom that's had to dial this down and do a lot of study. And now I'm going to blow your bubble a little bit here. I'm sorry, but I have to, and it's great that this is coming up. The immune system, just on the other side of the stomach, 70% of the immune system is in your gut. It's not in your bloodstream. 70% of everything to fight colds, flus, fevers, viruses, cancer cells, 70% of everything is in your gut, not in the bloodstream. And the immune cells that are the sentries standing guard in case any gluten comes down for a gluten-sensitive person or dairy for a dairy-sensitive person, those immune cells are called dendritic cells. And they're just on the other side of the stomach, in the first part of the small intestine called the proximal part of the small intestine. That's where celiac disease manifests, is where the inflammation is, and it tears down the intestines in the first part of the small intestine. So the dendritic cells are there. They're standing guard. And if any gluten peptides come through, a 33-pearl clump, a 17-pearl clump, any peptides of this gluten comes through that hasn't been broken down, the sentries just on the other side of the small intestine get activated, and they turn on the inflammatory cascade, and here comes all the inflammation, here comes all of the antibodies back in your bloodstream, and wherever the weak link is in your chain, here come antibodies to that area, whether it's your brain or your heart or your lungs or your liver. The whole cascade begins for 2 to 6 months from one exposure. 2 to 6 months from one exposure. The problem with these enzymes that you're referring to, and you really have the right concept here, the problem with the enzymes is that they take 3 to 6 hours to work. Food comes out of the stomach within 90 minutes to 2 hours. So if it takes 3 to 6 hours for these enzymes, these digestive enzymes to work, but food comes out of the stomach into the small intestine in 90 minutes to 2 hours, you activate the immune cascade. And so you set up this whole inflammatory cascade, and the digestive enzymes you've taken, they will work, but they work further down the digestive tract, but you've already activated the inflammatory cascade. This bothered me for years. And finally, I met 2 scientists. One guy had spent 6 years looking at this. The other guy had spent 7 years looking at this. And I spent 2 years with them. So that's 15 years of study between the 3 of us. I spent 2 years with them. And we developed a digestive enzyme that works within 60 minutes to digest 99% of all gluten peptides in 60 minutes. There's never been anything on the market like this before. So this is the one that we recommend to all of our patients and to all of the doctors to take a look at and start recommending to their patients to use. Because if you read the science, and any enzyme you get, you want to see the science. Show me the evidence that this works within 60 minutes, 60 to 90 minutes before the food gets into the small intestine, and no one can do that. They'll show you it works, and they'll have these graphs that it works, but they don't put the time down. They don't show you the time, and they take 3 to 6 hours to work. Every enzyme that's out there, except for this enzyme. because this was designed specifically for this purpose. And these scientists worked on it for 13 years between the two of them. It's called Glutenza. It's got three names. It's Glutenza, or GI Shield, or Allergenza. All three names is a similar product. Glutenza has rice bran as the carrier, but a few people are sensitive to rice, so they thought, well, I shouldn't have rice bran, although it's not a problem because there's no protein in the rice bran. But they were cautious about that, so we changed out the rice bran for beetroot fiber. And this is non-GMO beetroot fiber that comes from Sweden. So they're extremely safe products. I recommend all of our patients with the gluten sensitivity, you take one capsule before you start eating. Before you start eating. Anytime you eat out or anytime you eat grains. Why? Because in 3 of the last 7 Japanese restaurants that I've been in, I asked the waiter or waitress, could you ask the chef, please, if there's any gluten in this meal? Oh, no, sir, we don't use any wheat at all. I understand. Please ask the chef if he uses any wheat flour. And they do. In the tempura, they have wheat flour in the batter for that. But 3 of the last 7 Japanese restaurants, the waitress came back and said, oh, I'm sorry, sir, I didn't know. But chef puts a scoop of flour in the sushi rice because it makes it stickier. So you go to a Japanese restaurant, you order a rice dish thinking you're safe, and you're not. Same thing happened. There's a chain restaurant in the Midwest called J. Alexander's. I took my sister there, and we ordered a meal. She ordered a piece of wild salmon grilled with just a little olive oil, a little garlic on it. And I looked at the waiter and I said, how is that served? He said, we put it on a plate of rice with some vegetables. And I said, please tell the chef that we are gluten sensitive. And the guy looked at me because we'd already mentioned. He says, well, yes, sir, I know. I said, no, please make sure the chef knows. And you have to look them right in the eye. And when you listen to a couple of nutritionists on the Gluten Summit, they tell you the same thing. You have to be a little bit of a nuisance to some of these people in restaurants because they don't get the seriousness of this. So you have to look in the eye. No, please make sure the chef knows everything needs to be gluten-free. So at J. Alexander's, they came back. The waiter came back. I'm so sorry, sir, I didn't know, but chef puts a scoop of flour in all of our rice dishes. So when he cooks the rice to go for all their rice dishes, there's flour in the rice. So you don't know. You just don't know out there today whether it's a gluten-free food that you're buying packaged and 24.7% of them that are naturally gluten-free or not, or whether it's labeled gluten-free, almost 3% of them are not. That's why if you have a gluten sensitivity, you always want to take 1 capsule before you start eating of Glutenza, Allergenza, or GI Shield.
I know I've actually gone in the back of the I've actually walked and talked to the chef personally. I do actually every single time up at the restaurant that I'm not familiar with. We don't use either of those enzymes, so I'm glad that I've definitely wrote those down. My background, just for a disclaimer for those, I've said it on other interviews with other summit speakers, but my background is I used to work for Enzymatico, which is a leading digestive enzyme company, and I feel very confident with Gluten-Ease that they make. That's one I'd give my son, but I also know the founder. I know the people that designed it. But I think it's great that there's lots of different options out there and ones that you just have to really know to call the companies. And I think that with the families, especially in the autism community, a lot of us moms, we might not be MDs, but we always say we're an MD in the sense of we're mother determined.
Yes, there you go. That's fabulous. That's really fabulous.
So, you have to do your due diligence, and you have to, because companies do change, and there are different products, and you might know the product 6 months ago, but you might not know the product in 6 months from now. And so it's always important, if there's always ever a doubt, to talk to them and call up each company or go into the kitchen, because I do every single time. They know me by name. Granted, if they do a great job, I definitely tip very well. So I think that's also something for families to make sure you take care of your service people and take care of the restaurant, because then they don't mind, doing those little things above and beyond. I've even done it to where, I've said you need to change your gloves out. You cannot touch my son's stuff with the same gloves, and you need to make sure that those pots and pans that you're using are not the same, or the tongs are not the same. And, if you do it in a nice way and you're not like military mean when you go in, you're not trying to be a drill sergeant, often they'll be totally fine. You don't want to go in on a Friday night where it's totally busy and expect them to treat you like royalty. But if you've gone on, maybe you've gone on a Wednesday in the middle of the day and they know you and you create a relationship with some of these restaurants, when you do go on a busy Friday night, they definitely have already been trained and they know how to help you. So definitely would be my advice to these moms and dads out there. We got to take control of what's being fed to our children, and if we're not making it, we definitely need to make sure that whoever is making it is safe. I mean, would you agree with what I'm saying?
Yeah, I agree with everything you just said, and I know Terry Leonard, and Enzymatica is a great company. And
Enzymatica.
But I just had Enzymatica, yes.
Yes.
But I take issue with one thing. These companies do their very best with the information they have available to produce the very best product they can. Absolutely correct. And no one knew about this. So these products that have come out years ago as digestive enzymes, just ask them for the studies that show how long does it take to break down the gluten. Look for the studies, and what you will find is that most of the companies have produced a study. They'll tell you that, oh, no, it works. It really does work. I know. I feel better when I take it. So, yes, it's going to help, but you still can activate the inflammatory cascade. You have to take it to that level of requesting information to make sure what you're exposing yourself or your children to is the very best product that's going to work most effectively, because this sensitivity to gluten, let me tell you, let's go into the world of non-celiac gluten sensitivity for a few minutes, because so many people have said that this is a fad. It is no fad. I'm looking at a study right now in the journal Central Nervous System and Neurological Disorders, and this is from 2015. And this is the title of the study. First, I'm going to give a definition so that people understand when I say in the title of the study. There is a word here, it's a Scrabble word, it's called dysbiosis. Dysbiosis, we've all heard about the good bacteria in the gut, that it's there to protect you, and we can talk about that for a whole weekend. There's so much to say, and it's really important. But dysbiosis is when you don't have enough of the good guys in your gut, and you've got too many bad guys in your gut. That's dysbiosis. So now listen to the title of this article. Non-celiac gluten sensitivity triggers gut dysbiosis, neuroinflammation. That means inflammation of your nerves, gut-brain axis dysfunction. That means how your gut talks to your brain, the messages that go to the brain, dysfunction, not working right, and vulnerability to dementia. So I'm going to say this again. Non-celiac gluten sensitivity triggers gut dysbiosis, neuroinflammation, gut-brain axis dysfunction, and vulnerability for dementia. And in this study, they just outlined the step-by-step problems that occur when you eat gluten. And once again, as we said earlier, Harvard showed a study that every single human has a problem and cannot break down gluten. Every person does, and they get intestinal permeability from it. And what they say in this study, non-celiac gluten sensitivity triggers gut dysbiosis, neuroinflammation, gut-brain axis dysfunction, and vulnerability for dementia. The last sentence of the summary of the paper says, let's see, just one moment, let me look at this. Therapeutic measures, including probiotics, antioxidants, and a couple other factors are pretty technical, may ameliorate, means get rid of, neuroinflammation and oxidative stress in non-celiac gluten sensitivity. They may therefore prevent cognitive dysfunction and vulnerability to Alzheimer's disease.
Oh, wow.
So we have a direct link here, and there are a number of papers like this that talk about having a sensitivity to gluten without celiac disease causing your brain to not function very well and developing dementia. And you don't feel it when you have toast for breakfast, that you're throwing more gasoline on the fire in your brain. You don't feel it. You can't feel it until you're in your 40s or 50s and you start making jokes that you're getting old, that you don't remember the way you used to. Haha. And you're getting older.
Mm-hmm.
How old are you? I'm 42. No, I don't think so. I don't think that's right. Dr. Dale Bredesen runs the Alzheimer's Research Center at UCLA. He published a paper a year and a half ago reversing Alzheimer's in 9 out of 10 people in 5 years by going through a 44-point checklist. And one of the first things they do, they get gluten out of their diet, everybody. But there's 44 different things they have to do, not just get gluten out, but you have to stop throwing gasoline on the fire before you do anything else. So everyone has a problem with this, whether they feel it or not. That's the important thing, whether you feel it or not. We all have a problem with gluten, and it just depends on when you cross the imaginary line and you start feeling it. It just depends on your own history, the antecedents, the things that came beforehand, and your genetics.
I feel like I can't believe almost an hour is up. I think that this has been so just so wonderful for the families because there's so many different different theories on what is gluten and should we start the gluten-free diet, or a lot of times people will tell me, oh, that's just the Hollywood fad, and I am glad in a lot of ways that it has become somewhat quote unquote a fad, because now we can find things a lot easier, even though, as you mentioned, we definitely have to look at the labels and really know the companies we're buying from, because that 3%, of the labels not really explaining, I think is huge, especially if you have true celiac. But, I've said this many times before when I talk about this, but 11 years ago when I started gluten-free with my son, almost 12 years ago now, there was nothing out there. Everything tasted like cardboard. It didn't taste good. I joke about I went through probably 3 to 4 waffle makers trying to figure out how to make a waffle even for my son, because they didn't have the flours that they have today. And so I do think that we're definitely on the right track, even though it sounds as though we still have a ways to go. But from where we used to be, oh goodness, I mean, at least we can buy things that for our kids, they don't have to give up all their childhood things that we had growing up, and I think that's so important, especially for families that, they're scared to switch over because they think, well, what is my child going to eat? And there's so many options today, and a lot of really great companies out there that really do their due diligence. And I can say that, with confidence, just because I am a mom out there and my son is not just sensitive, truly allergic, and it can set him back for months and months, exactly what you were talking about. And behaviors will change and moods will change. And so I have to be very careful. So, it wasn't always like that, though. It wasn't that easy before. It didn't seem like there was very many companies at all. So I am glad, quote unquote, the fad kind of is there. And we can go to restaurants from time to time, very selective ones. But gosh, I feel so grateful to be able to talk to you. And how do people find out more about you and they want to learn more about you? Where do they go?
Oh, well, thank you. It's a pleasure speaking with you also. It's the website is thedr.com, thedr.com. And there's a lot of free information there, and interviews and radio show interviews and handouts like the conundrum of gluten sensitivity. That one is there. We actually have a few things for your listening audience. If you go to thedr.com and /gluten trilogy, gluten trilogy, that's trilogy, one word, gluten trilogy, and we call it the gluten knowledge trilogy, that there's a number of things there for you. The conundrum of gluten sensitivity. There's an interview that I did with the founder of functional medicine, Dr. Jeffrey Bland, and a wonderful nutritionist named Dr. Deanna Minnick, where we talked about non-celiac gluten sensitivity. There's a couple of other educational videos there at thedoctor.com /gluten trilogy. and there's a $10 cash certificate to use in the store if somebody wants to try those digestive enzymes. You're welcome to do that. That's all there for you at thedoctor.com/gluten trilogy.
Wonderful. And then what's a final message that, we talked about a lot today. What message do you want to leave parents with today?
Oh, thank you. That's really a good one. This is really difficult. 132.5 pounds of wheat per person per year in the U.S. And I don't eat any, so that means somebody else is eating 265 pounds, and you don't eat any. So, I mean, a lot of people are eating way more than 132.5 pounds. It's in everything. It's in all of our pastries. You walk up to any coffee counter, all of the pastries there are full of wheat. Of course, they're all made with wheat. We've grown up in this world. We think it's okay. But there's 2 points to give you to hope that it'll be stimulatory for you. The first one, the New England Journal of Medicine tells us that for the first time in the history of the human species, for the first time in the humans, our children born today have a shorter projected lifespan than their parents. They're going to get sick at an earlier age, get diagnosed with diseases at an earlier age, and die at an earlier age than their parents. That's never before happened in the history of humankind. The second point is that the World Health Organization rates the United States second in overall quality of health care. Second from the bottom. Out of 53 industrialized countries, we're ranked second from the bottom. Yet we spend more than any other country on the planet for health care. Just follow the money, and you realize we're all being led down a path to think a certain way of how to take care of ourselves and to allow this to go on. We all have to do exactly what Kristen has done to protect her son. We all have to learn how to do this, be a little bit of an annoyance in restaurants, be kind and sweet, but be firm, so that you don't allow your child or allow yourself to be contaminated and poisoned. It really is a poison. Be poisoned because you didn't want to create a scene. I don't want to be an annoyance and all of that. You really have to learn how to protect yourself and your family, especially to this audience about autism. The brains of autistic people are so incredibly developed. My experience of autistic kids is they're so smart. They are so incredibly smart, but some areas aren't processing really well, and so they have a hard time functioning. The more inflammation you create, the more difficult it is for a brain to function. So by learning how to protect your children and your family with an anti-inflammatory lifestyle, an anti-inflammatory diet, you go a long way to helping them not only cope, but thrive in the world that they're in. I think that is so critically important to understand. We all have to wake up about this. You can't just put your toe in the water here because, look, when I came out in practice in 1980, the statistics were, it was somewhere around one child out of every 4,800 was on the autism spectrum. And the newest statistics that just came out from the National Institute of Health is 1 out of 46 kids are on the autism spectrum now. When I came out in practice, 1 out of 4,800. Now it's 1 out of 46. We all have to wake up. What we're doing unintentionally, we're allowing this to occur. You speak with your dollars. You buy the foods of the people that are trying their best to give you the purest food, and you still check and make sure it's pure enough for your kids. I think that's the best message I could give to you, and I think it's wonderful what you're doing, Kristen, in your Autism Summit with the Autism Hope Alliance. I think it's wonderful because people need this information. They need to hear there's so many pieces to this puzzle. You just keep going for base hits, and eventually you win the ball game.
I love that analogy. Just keep going for base hits, and eventually you'll win the ball game. So I'm just going to be thinking about that. Anytime I'm having a little bit of a hard day, I'm just going to say, hey, I just need to get to the next base.
Exactly right. Exactly right. You just have to get to the next base. Good for you.
Well, thank you so much for being here and helping our families, and just thank you for everything you're doing as well.
Kristen, thank you so much.